the innovative mesh scaffold, non-surgical rhinoplasty. The fillers is just for dorsal augmentation these days, but not for tip projections due to so many side effects. The insertion point of the conventional loose thread may cause scarring here, and the threads may migrate or extrude, and they can migrate away from their original positions. For dorsal augmentation, over 10 threads are needed. Under 6 threads, it is unlikely you would see a noticeable difference with that amount. So ND, NC, NA products are parts of a Tesslift soft node series that compensate the defect of the conventional loose thread. They are a unique foam designed to reduce the side effects and to support forces where proper force is required without moving, which means the adhesion. Unlike the conventional loose thread, they have ability to continuously maintain the state post-procedure without distortion and widening. Due to proper tissue ingrowth, the nasal dorsum centered on the mesh scaffold is gathered. Such effect is impossible to be seen with fillers or conventional threads. The results are significantly longer lasting than fillers and conventional loose threads because the mesh scaffolds encourage natural collagen production and tissue regeneration, which add further structure, firmness, and contour to the area. They act like a real scaffold. They will give a more defined contour look. If you are looking for height and volume, a filler will give a good result, but less definition. In terms of those threads, the thread migration and breakage are complications which have been observed and may occur, but for mesh scaffolds prevent these problems. The tissue recognizes the mesh lining as foreign substance and encircle the perimeter of the mesh pores. The mesh pore size should be adequately maintained for proper tissue growth. This is the end type for nose dorsum. It is a highly innovative mesh medical device with a central barb thread with proper direction, suitable design for stable installation of nasal root or bony structure, and unique structure to prevent extrusion or migration. Fillers and the conventional loose thread spread and deform the gap between the both medial crooks of nasal columellar on either side, resulting in a sharp decrease in the nasal tip projection effect and problems in the subsequent surgery. Effective and continuous nasal tip projection due to the gap here being brought to the center by tissue ingrowth into the proper mesh pores is possible. The mesh scaffold have a role of medial crural fixation without obliterating of the natural flare of the caudal border here, and establish exactly the base of the column on the anterior nasal spine. This is for the nose columellar. For the protection, it has special design which properly touch the bone and prevent distortion and migration. For the Tesslift Soft NC type, effective and continuous laser tip projections is possible due to the gap between both sides medial crura being brought to the center by tissue ingrowth. It plays a role of columellar structure, and the mesh structure functions like a medial crura fixation suture. Erecting the nasal column with the mesh scaffold establish the base of the column on the sound wall of the anterior nasal spine. This is for the nosolar NA type. It has a special design which make ulnar reduction and use reinsertion technique. Both exposed mesh scaffold can be reinserted. Which make ulnar reduction and use reinsertion technique to make a strong adhesion and a volumizing effect. So the effect of the conventional load thread is lost only by skin movement because it has no adhesion effect. However, Tesslift Soft NA type has a strong adhesion due to tissue ingrowth into the mesh pores and maintains the effect despite the skin movement plus volumizing effect. So along with the ulnar reduction and projections effect, the NA's more important effect is the subnasal volumizing here. Volumizing effect as through the reinsertion techniques, as 5 layers of mesh scaffold are subnasally located. The nasolabial angle is properly widened due to very effective volumizing. Then the lip looks less protruded, so that creates more sophisticated look. So this is NG type. So gently push the mesh scaffold prefilled cannula along the deep fat layer through the punctured hole. Insert straight through the deep fat layer so that the mesh scaffold passes through the center of the nose. Feel the bony cartilaginous junctions and feel like slight scraping of the periosteum of the nasal bone for nasal dorsum, and be careful not to go under the nasal bone. And this is NC types. When injecting the NC, put your thumb and index finger over your opposite hand into the nasal vestibule and pull up the nasal tip like this, and insert with the sense that the force of lifting the nose pushes the cannula down. The state of strongly stretched skin should be maintained until the cannula is completely removed. After the procedure, patients are trained to light stretch the nose downward and forward. For 5 days after the procedure, it would be helpful if the patient's massages twice or once a day by holding the tip of the nose. We sense that it gets pulled forward around 10 minutes. This is to prevent extrusion before the mesh is firmly attached to the tissue. This is before and after. I used a 2ND and 2NC type. The mild hump that existed prior to procedure or almost eliminated after the procedure. The nose dorsum was raised and the nose tip also raised and the cephalic a little rotated. Therefore, we can see that the distance between the front line has become more constant. This is before and after. You can see that the nose tip was raised after the NC type. I just used the 2 pieces of the NC types. Usually I use 3 pieces of NC for the tip projection, but it depends on the patient's conditions. Yeah, this is another patient. I used for her 3 MDs and 2 NC, 3 NC. Yeah, so we can notice that the low and wide nose dorsum before the procedure has been raised and narrowed after the procedure. Also, the nasal tip here. So this is before and after I used for her 2 ND and 3 NC. This is frontal view or lateral view. Also have some mild hump after the procedure. Yes, I used for her 3 NC. Yeah, a little projected more, a little rotated. Before and after, yes. The projection. See the projection. The other patients I used for her 2 NC and 2 ND. This is before and after. Yeah, after the procedure, you can see the widened nasolabial fold angle. Yeah, I just 2 pieces of NC for her. The other patients, this is before and after. She has the hump and her tip was drooped. I used 2 NC, 2 ND type, and 3 NC, and also I used 1 NA type for her alveolar reductions. This is before after the procedure. Yeah, tip protected. A little her after use the NA type subnasally. The 5 layers of mesh scaffold of NA type is located subnasally. It has very strong volumizing effect. So after the procedure, we can another very effective result. So which means the widened nasolabial angle. You can see here before. Her nasolabial angle before the procedure is just under the 90 degree, but after the procedure, you can see the over 100 degree of her nasolabial angle. Yeah, the same patients. Yeah, so another patients I used for her 3 pieces, 3 pieces of NC type. After the procedure, we can find the tip projection and also find a more symmetrical after the procedure. So it is a little possible to correct the kind of asymmetry after the procedure. Sometimes I used used the nose series or freedom other Tesslift soft or Tesslift series products with this kind of PDRN solutions. It acts like the lubricant, and it also has another the very effective wound healing effect and diminish the post-operative edema. So RMDS is the professional dermal care brand that concentrates multifunctions for one-step treatment via the PDRN lipolytic solutions and the hyaluronic acid, ascorbic acid, or other growth hormone factor. During the procedure, the use of the RMDs is not only provide wound healing and tissue regeneration, but also it acts a lubricant and thus reduce the resistance during the procedure, which facilitate treatment and reduce the wound. So it is very well tolerated at the application site. Properties declared by the client have been confirmed and has a moisturizing effect and evens the skin tone and has brightening effect and provide skin restoration rejuvenation. In the test group of volunteers, there were no irritation and allergy reaction. I sometimes combine with this kind of solutions, and then I show and show video. Yeah. We in, in, in my PPT presentations, we could find her two projections. Let's say patients. Yeah, it's an entry point. Yeah, this is nasal root. This is body cartilaginous junctions. So there's a big line center. There's a bony cartilaginous junctions. The nasal root. This is target point because the actual mesh scaffold is located behind from the tips. The depth is around 4 or 5 millimeters. So we can insert the tip over the target point, 4 millimeter over, like this. This is ended tight. The gauge is 19 gauge. It has the special design to prevent the extrusions. The actual real factor to prevent the migration is stitching loss, which means the mesh itself. This is sometimes I use these kinds of solutions. Yeah, that works. So I make an opening with the 19 gauge needle because this cannula is the same size, the 19 gauge. Yeah, and then slowly, yeah, you don't need to hurry up. Slowly, take your time, and then feel the bony cartilaginous junctions, and then over the bone, you can feel the scraping of the periods. Okay. Yeah, that point means the opening side of the annular. Yeah. Feel the tip like this and stretch downward like this until the total removal of the cannula. You have to maintain this stretching. state. The second one. This is NC type projections through the same opening. Change your position like this. You can use your thumb and finger of opposite hand and slowly insert. Insert the sense that force of lifting the nose pushes the cannula down, and the state of strongly stretching the skin should be maintained until the cannula is completely removed. Yeah. Second, as insertions. So when injecting NC, it is important to put your thumb and index finger of your opposite hand into the nasal vestibule and prop the nasal tip and fill the cannula well. So prior to surgery, you also need to sterilize nasal vestibule. This is before and after the tip projection. You can find the tip projection after the procedure and the little correction of the little asymmetry. And the next is the second patients. I performed 2 NC, ND and 3 NC and 1 NA for her. This marking is for entry point, exit point for NA type. Yeah, this is a 30 gauge short needle. If I perform the NA type, I sometimes use the injects inside the mouse. Sometimes I block the inflow of the block for only the local injections. The exit point. You can change the location of the exit point or entry point according to the patient's the shape of the flaring of the nose. This is for NA type, the local injection for this is. Yes, this is 19 gauge needle. Make an opening. This is 18 gauge needle to make an opening of NA exit point and entry point. This is ND type for nose dorsum. If the cannula is felt to be tucked in the periosteum of the nasal bone, the cannula is fixed and then advanced by strongly pulling down the skin with your left hand. Yeah, like this. Strongly pulling down the skin with your left hand during the procedure. You can feel the tip over the target points. Since the mesh scaffold is located about 4 mm behind the cannula tip, it should be inserted 4 mm more than the target point. Yeah, strongly stretching until the total removal of the cannula. And the second insertion of ND. Yeah, pulling down the skin with the hand. What is the total. And then the next is the NC or projections. Through the same opening. So position of the mesh scaffold anterior to the middle crura, and then between the medial crura of the lower lateral cartilage. The second NC insertion. While holding the nasal tip with 2 fingers, the needle is carefully advanced using the other hand to feel the resistance. Yeah, that's it. And then the last one is the NA. One more NC insertion. Okay. Yes, this is entry point. You can try to find a less resistant plane and take your time and slowly proceed towards the exit point. It is not easy to find the exit point, you can use the 18 gauge needle, or you can widen the exit point with a sharp-ended iris scissor. Yes. Sometimes it is not easy to find the exit point. And yeah, and then hold the tip of the mesh scaffold and remove it. And then you can control the degree of the flaring. You can reduct the alert, and then just reinsert the post-exposed mesh scaffold. Through this step, you can locate The 5 layers of mesh scaffold can be located subnasally. It has very strong volumizing effect as time progresses. It's a very simple procedure, but the effect is very good. Yeah. For the re-insertions, yeah, like this, insert subnasally. So 5 layers of mesh scaffold can be located. So yeah, these patients. And I'm sorry, my presentation is too delayed. So I just present my last video more fast. Same patients. Same patients, same techniques. Yes, this is any type. Yeah. It is important to use your opposite hand properly, strongly pulling down the skin. So before the procedure, we have to check up the patient's skin flexibility, skin 지훈아, 그게 뭐지? 그 탄력 신축성이 뭐지?
Elasticity.
Oh yes, elasticity. Okay. I forgot the word, the elasticity. Okay. Yeah, so we have to check up before the procedure. The elasticity, skin elasticity is important factor to perform this kind of those procedures. Some patient has very flexible and very elasticity at the skin. So at the times you can use the more mesh scaffold for those kind of patients. But if the patient's skin is very thick and the very low elasticity, at the times we have to be a little careful. So we always consider the elasticity of the patient's skin. Okay, the same patients, the same technique. Okay, this is my first presentation.